no sperm. Okay, so the how sperms start, so to speak. All right. So we are going to look at how the sperm starts. All right. So you come across words like spermatogonium, and the plural is spermatogonia. This can be used interchangeably with words like germ cells and words like stem cells. You mention stem cells and use it, I mean, more frequently. You can on the from the chart. Where do you remember stem cells? Very, very well within laboratory concepts. Anybody with idea about stem cells? Yes, sir, I'm getting an answer. Hematology, is that very good, and that's good. From bone marrow, very good. Hematology, and that is my hematology. Cells preserving itself. So when the stem cells from the stem cells, if the stem cells is to divide and go on, they do that at a certain point. The stem cells, the original stem cells will be finished, isn't it? But the good thing about stem cells is that they will divide. All right. Once they divide, then they make a decision. One should go on to differentiate, and then to whatever cell that it wants to be. And one will have to remain as stem cells. That is the good thing about stem cells. So whatever the stem cells, what it means is that that cell will divide and make a decision that as to how they decide that cell A or cell B should move on to differentiate and become the mature cell that we want. That decision I cannot explain why, but there is a concept called fate. All right, where to tell somebody's fate, I'm sure not fate as in F-A-I-T, no, F-A-T-E. When you tell somebody's fate, then it's like you can make the person die or live. So stem cells have that kind of how do you call it, capacity to make a decision. Once it has divided, one of it should continue progressing to the final cell, and the last one will remain. So that at any particular point in time, stem cells will still be alive. And so spermatogonium has that, what do you call it, has that characteristics. And therefore, it tends to be called stem cells, because as you move along, you see that the spermatogonium, which is also the germ cells, behave like a stem cells to the extent that the germ cells will divide, and then one of the, whenever you cells divide, of course, they become two identical. But with the two identical, one will stay and become part of the stem cells again, and one will move on. So it means that spermatogonium can also be described as a stem cell. That's what it means. So as you move along, you can appreciate it better. But what I'm saying that spermatogonium is also called germ cells. It's also called stem cells. I've tried to explain why. And it's undifferentiated primary cells in the male gonads. I'm sure you know the gonads. The gonads If you say male gonad, because if you say gonads, it can be male or female. We're talking about the sex organ. Okay, so if you're talking about sex organ, it can be male sex organ or female sex organ. So if you say gonads, then you're talking about either the male or the female. So in order to make it distinct, the fact that we are dealing with the male reproductive system, it is just important to bring the male in addition to the gonads. I hope that you are getting it. So the primary, that's the beginning of how the sperm will be formed. And that is also for germ cells. It's like that is also the parent cell which will give rise to the other cell. So other spermatogonium or germ cells or stem cells, they can be used interchangeably. Spermatid. Now, as you move along, you realize two important things. That at one point, the sperm itself, the mature sperm itself, is a haploid. When you talk about haploid, as we move along, you explain that it has one set of the chromosome. You know, the chromosomes have two sets. You know this already. It's a pair where one is coming from each parent. So when we talk about haploid, we're talking about that cell that contains only one set of the pair of chromosomes. And so if you have one set, then your chromosome now become 23. This one's, you know, elementary anatomy. And then for the complete pair, it becomes a pair of the 23. So that becomes 46. So normally, we represent the set of the 23 as n, and the pair as 2n. All right. So for a spermatid, it's a haploid cell. What it means a haploid cell is that it means that it's a cell that contains one half of the set of chromosomes. Now it is produced by meiosis. As we move along to differentiate between meiosis and mitosis. All right. So the spermatid is a haploid cell produced by meiosis of a spermatocyte that develops into a sperm cell. As you move along, you can understand all this better. But what I'm saying is that you must have an idea about terms like spermatid. All right. And whenever you talk about spermatid, it's part of the stages of sperm development. All right. And this one has one set of chromosomes. The original germ cells is a complete cell, and therefore it will have the the pair of the chromosomes. All right. So the original, the primary one, is not a half cell. It is a complete cell, and therefore it's a diploid. All right, it's a diploid. So once it's a diploid, then so that the whole thing started from a diploid, and then along the line it became haploid. So something must happen, and the process which transforms a diploid to a haploid is called meiosis. All right. So the thing is a pair. Okay, a pair. And whenever cells divide, they divide and become identical daughters. So if they are identical daughters, then what it means is that if the original cell has two sets, so has a pair of chromosomes, then once it divides, because it's identical, you should also have that pair of chromosomes, and there are two of them. That's different. That's different. That's actually mitosis. But if this cell, which has a pair of chromosomes, 23 of the two of the 23s now has not become a cell of only one of the chromosomes. Then it means a lot of things has happened. That is a process called meiosis. So meiosis will result in a haploid cell. While mitosis will result in a diploid cell. All right. So, like we said, from spermatozoon, that's the plural for the spermatozoa, and then it is the mature male gamete. So the male gamete, the male cell there is the spermatozoon, and its plural is spermatozoa, and it can be shortened to just sperm, and this is also acceptable. Of course, as we've explained before, diploid is the cells or cells containing two sets of chromosomes. Now, so we have it as two ends. So one set become 23 chromosomes. So the two sets becomes 46. Okay. It is formed by the fusion of two haploid cells. So if you have two haploid cells, then they can become a diploid. A haploid cell possesses only one half of the genetic material, which is the chromosomes, and therefore that comes in. That's why. So, in effect, when you have the male sex gamete or the male gamete or the sperms, if it goes to fuse with the female ovule, that was also, remember, they are all gametes. Then this is also a haploid. Then the two of them will now form a diploid. All right. So a haploid 23, and that haploid from the female side will also 23. When they fuse together, the zygote becomes 46, which is a diploid. So these are small things that you know already, just for the sake of this program, you just want to go through it. So in humans, haploid cells are only present in the gametes. All right. So for every cell, all human cells are all diploid, except the gamete. All right. Because in the gamete, and when talk about gametes, it could be male or female. All right. So the male gamete will meet with the female gamete and they fuse together. So that's where diploid system comes into being. So that understanding must start right from the word go. Apart from the sex cells, the male and female cells very rapidly, so that if you don't take care, you wouldn't see them as two different stages. But meiosis will start with a diploid cell, end up with a haploid cells, and usually the end product are 4 of the haploids. These are all some terminologies that we come across in the course of the discussion. All right. So mitosis is a process where a single cell divides into two identical daughter cells. This is the one we know all the time. That we have a single cell, which is a diploid, which we divide to give you two identical daughter cells. And of course, they are all diploids. All right. So in the development of the germ cell, when talking about the sperm, to start as a germ cell, in that development, the germ cell is a diploid, but the end product, which is the mature sperm cells, is a haploid. So it means that there must be a process of converting it from the diploid to the haploid. All right. but it will not begin immediately. So you have a first stage where the first division will still be a diaper from but we want to say that so in the sperm at the same time. All right, within the process, within the sperm development, there will be mitosis, there will be meiosis. All right, and you must appreciate right from the beginning the difference between meiosis and mitosis. Mitosis is just doubling of the cell to give you two identical cells. And once they're identical, they are going to be like the parent cell. And of course, the parent cell is a diploid, and therefore the daughter cells are also going to be diploid. Still on spermatogenesis. So what is it? Like I tried to explain earlier, is the process by which germ cells, and the germ cells are the primary cells that develop to produce the mature sperm cells. Of course, these things will happen within the seminiferous tubules, and you cast your mind back to the structure of the testes, right? Now, we're saying that within the seminiferous tubule, you have germ cells, and not just germ cells, you also have the Sertoli cells in there. Remember, we said that the germ cells must be nursed, must be nurtured, must be sustained by a bigger cell we call the Sertoli cells. All right, so within seminiferous tubules, we have the germ cells there, which are going to be nurtured by the Sertoli cells. And these things will happen within the seminiferous tubules. Remember, the other cell, which are the lady cells, are outside the seminiferous tubules. All right, and you know these things already. Now, so within the seminiferous tubules, the process of spermatogenesis takes place in there. Now, so the spermatogenesis takes place in 4 stages or phases as follows. So there's mitosis, there's meiosis, there's spermiogenesis. Look at this. The original one is spermatogenesis. The third phase we're talking about here, spermiogenesis. And the final one is spermiation. So for cells to develop from the germ cells up to a mature sperm cells, it will go through mitosis, they'll go through meiosis, they'll go to spermiogenesis, not spermatogenesis. The entire thing is spermatogenesis. This one is spermiogenesis. And then we talk about spermiation. So that is the stages that we're going to talk about one after the other. All right. So stage one, we're talking about mitosis. And remember, we said that within the seminiferous tubules, you have germ cells that, and you know that it's a tube. So every tube will have a baseline. I'm sure you can imagine it. The tube will have a baseline. If you cast your mind back to what you did in the structure of the testes, so you have a tube, and within the tube, there's always a baseline within the tube, right? So within that baseline, the cells that line the baseline are we have the germ cells there. You also have the Sertoli cells. Remember, we said that Sertoli cells, they are also protective to the extent that the one cell to the other cell have what we call a tight junction that that actually provides what we call the blood testis barrier. Remember, we talked about the blood-brain barrier in the CNS. We also talked about the blood testis barrier. All right, the blood testis barrier, the the protection is provided by Sertoli cells, where they have the cell-to-cell provides what we call a tight junction, which will prevent macromolecules and other things from entering. Because we said that at the end of the day, you are going to have sperm cells being produced. Sperm cells are haploids. And we have said that the body cells are all diploids. So if you introduce a haploid into a system that is already a diploid, the system is going to see it as foreign and therefore attack it. We know this from the basic andrology that we did. So you need that protection where the enclosure or where the sperms are going to produce will be protected from it's actually going to be dividing and progressing to become the sperm cells. They are there as the germ cells. And they are also called spermatogonia, and they behave like stem cells, as I've tried to explain before. So to make the characteristics all combined, we say spermatogonia stem cells. I'm sure you will not be confused. So the spermatogonia sperm cells are found within the seminiferous tubule. So you know that. All right. And they are surrounded by Sertoli cells. You know this already. Right. So during the first stage of spermatogenesis, that's the first stage of sperm development, a single diploid spermatogonium stem cell undergo mitotic division, resulting in two identical diploid daughter cells called the primary spermatocytes. They look chunky, but I'm sure that if you follow it, that will you understand. That now you understand the spermatogonium stem cells. They are there within the seminiferous tubules, and they are supported by the Sertoli cells. They are now going to be divided. All right. Now, the third division can never be meiosis, because if you do that, then the original cells will deplete in a very short time. So you have the germ cells will have to progress first by mitotic division. And we say that in mitotic division, the cells will divide to give you identical cells, and which are also diploid. Remember, the germ cells or the spermatogonial sperm cells, they are diploids. I'm sure you are not confused about that. They are diploids. Okay, they are diploids. So once they undergo mitotic division, then their daughter cells will also be diploids. I'm sure you know that. We saw that in mitotic division, it produces identical cells, and they become two. So you are going to get a double population of the identical, of the what do you call it, spermatogonial stem cells. It's going to be double. But to differentiate it from the original spermatogonia, these are called primary spermatocytes. Primary spermatocytes. How the point is clear. Good. So the first mitotic division will give you primary spermatocytes, and they will be virtually identical with the spermatogonial stem cells. They are round cells with central nucleus, with every cell will have mitochondria, have everything like that. And they are going to be identical with the primary, what do you call it? The primary germ cells. Okay, but they have come out of a mitotic division, so they become primary spermatocytes. So, please, you draw me back if something is going wrong. Now, so after the first stage, so in first stage, you are talking about mitosis, right? Which we divide to give you the primary spermatocytes. Then we go to so At this stage, still on the distance, remember we talked about the fate decision. Fate not in FAITH. Fate as in something bad or good can happen to you. Right. So there's a phenomenon called fate decision. Fate decision. So one of the cells, which I mean, we are talking the fact that the primary cell, the germ cell are divided to give two identical cells. Good. Then one of them will have to be recognized as part of the germ cells. And one will have to be allowed to differentiate, to go ahead to become the eventual mature cell that you want. I hope that you are not confused. So at that point, there's what we call fate decision. And that one, like I've said, the mechanism for that one, I don't know. But what happens is that we divide into two, then one, either by random decision, one will have to say, and that is the characteristics of every stem cell. So, for example, we have cells of the skin, which will have to be renewed every time. The skin cells have stem cells. Otherwise, the skin will have depleted. So, some will have to, once the cells divide into two, some will have to remain as a stem cell, and then some will also have to be sacrificed to go and also protect the skin as epithelium. All right, so that's the characteristics, innate characteristics of stem cells. So there's always a mechanism to keep the stem cell population alive. So that phenomenon of fate decision is not just for spermatozoa, for any situation where stem cells manifest. And our hematology colleagues know that better. That in hematology, sorry, in the hematopoiesis process, stem cells will never be depleted because once they divide, there is that conscious effort to make a decision to retain one part, to go back to stem cell population, and then one part will be sacrificed. It's like now you go on to become what you want to become. So the one which will go ahead is deemed to have been lost, because if you when it goes through the division or differentiation to become let's say if it's a red cell, means that if it's a red cell, eventually it's going to die. It's going to have a lifespan of is it 90 to 120 days or so. It will die. It means that that cell has been lost. So similarly, within the spermatogenesis, if you have a parent germ cell which is behaving like a stem cell, it will divide. First procedure is to divide into two and then make a decision. So the one which will go back is going to renew the stem cell population. And then the one which will go ahead and become stem cell is deemed to have been lost, because once it becomes a sperm cell, it's naturally going to be ejaculated, and then only God knows end. So it will deem to have been lost. So that is what I want you to know, not just for spermatogenesis, but for all situations where stem cells are to prevail. Example of the skin tissue made up of stem cells. You have stem cells in the skin because the skin will always have to have new cells to make up the skin, because for all stem cells, the fate decision phenomenon will prevail. I hope I've talked too much about this one. You can appreciate it. Right. So still on the mitosis, the one that has self-renewed is reincorporated into the same cell pool. You understand this already. And the one that has taken differentiation path is considered lost. I think I've explained this already. And the reason why it is lost is that once it is going to become a sperm, it will deem to have been lost. To the extent that even if, I mean, as you move along, you will appreciate it. That if you don't even ejaculate, the system has a way of mopping up the 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 the, 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 the sperms into several ways. There are several ways mechanism. If you don't ejaculate, if you say you don't want to have sex or whatever, then the sperm cells which have been produced automatically, whether you like it or not, even if say you're going to be, I mean, you don't want to have sex, the sperms will be produced anyway. The body will have a way of giving it off. All right. So it will necessarily have been lost. That's what we're talking about here. So remember that spermatogonia and the primary spermatozoas are both diploid. I'm sure this one is very easy to understand. The spermatogonia, you know the difference between the spermatogonia and the primary spermatozoites. Spermatogonia is the original primary germ cells. And then they will divide by mitosis. So the products, they are very similar to the spermatogonia, because they are also diploids. And here they are called primary spermatozoites. It is this primary spermatozoites so they have to undergo the fate decision phenomenon, where because they're already very identical with the germ cells. I mean, they'll go back and behave as if they are also stem cells, and nothing will happen. Then the other half will now proceed in the processes that we're going to talk about to become a sperm cell. I hope you are following, please. Please give me some 1 minute, 2 minutes to pick up a certain. Give me a minute. I'm sorry. I'm sorry. I'm sorry. There was a call which kept on coming. I was putting off, but I felt that I had to. So sorry. I'm back. So I'm sure up to this stage, you appreciate very, very, very well that for the first stage of spermatogenesis, there's mitotic division, mitosis. And for mitosis, you have a cell which is giving birth to two daughter cells, which are identical to the original one. And here we say that for as far as spermatogenesis is concerned, the primary cell is spermatogonial stem cell, and I'll explain why the names comes up as such. And they will produce the first line of daughter cells, which become the primary spermatocytes. Primary spermatocytes will now undergo the phenomenon of fate decision to decide that yes, you now have two daughters. One of us will have to progress, divide to become the sperm cell. One of us will have to go back and become part of the pool of stem cells. And that fate decision, I've said over and over again that it is for all tissues or cells that are said to be stem cells, because their population will have to be maintained. And so that if they divide and keep on going to become the mature, whatever, it means that with time, the population of the stem cells will be updated. So that fate decision phenomenon is very, very important to maintain the survival and the perpetuity of stem cells. And this is exactly what is happening in the germ cells or spermatogonium stem cells within the seminiferous tubules. So now, if traverse or gone past the first stage will end at the point where the primary spermatocytes make the decision to choose one of them to go along and the other one to go back. All right. So once that choice has been made, then it starts another stage. That becomes the stage 2. So in the stage 2, we are going to go through meiosis. Now the decision has been made already. So we are now going to now let this primary spermatocytes go through meiosis. And you say that in meiosis, the cell, which is now a diploid, will have to convert it into a haploid. I hope that point is clear. Now, so that's all about stage 2. So in stage 2, there are 2 rounds of cell divisions of meiosis. And so if you have 2 rounds of meiosis, what it means is that the first round was split into 2, the second round was also split into 2, and therefore you're going to get 4. All right, and they're all haploids. They're all haploids. So in the meiosis 1 and then meiosis 2. Remember, we're talking about the end of the mitotic stage or the stage 1 gave us primary spermatocytes. So meiosis 1 is converting primary spermatocytes into a secondary spermatocytes. I hope that point is clear. All right. So from meiosis 1, from stage 1, we have obtained primary spermatocytes. The primary spermatocytes will undergo meiosis 1 to give you secondary spermatocytes. All right, then the secondary spermatocytes will divide again in meiosis 2 to give you spermatids. And the spermatids are 4.
So I know that.
Okay, why? So we are not going to go through the phases of meiosis and the anaphase or all. No, we are not going to do that. But if you want to go and read about all those things, you can go and read about them. But for the purpose of this course, we are not going to go through the anaphase, telophase, or we are not going to do that. Just say that within the stage 2, there are 2 steps of meiosis. The first step would take you from the end product of stage 1, which is primary spermatocytes, to secondary spermatocytes. Then meiosis 2 will take you from secondary spermatocytes to spermatids. And then that will be the end. Remember, at the end of meiosis 2, we have gotten 4 haploid cells. And these 4 haploid cells are spermatids. And they are all still, they are all like the original stem cells. Why are they like the original stem cells? They are like the original stem cells because they are all rounded. They all have nucleus. They all have mitochondria. They have everything, except that in the spermatids, the DNA or the genetic material, instead of being paired, is only a single. It's one set instead of 2 sets. Otherwise, spermatids are just like the original stem cells. They are rounded. They are, apart from the nature of the nucleus, which is a haploid, they have the same characteristics as the original. They are all rounded. At this point, spermatids are never like sperms. So take note of this. At the end of stage 2, which will have given you the spermatids, the end product of stage 2 is virtually like the primary germ cells. How are they like that? They are like that because they are still round cells. They still have a central spherical nucleus. They still have mitochondria. They still have the centrioles. You know, a cell, what a cell will have. They have everything, except that the DNA here, the genetic material here, is now one set instead of what? The double set that we had in the previous ones. I hope my point is clear. So the creation of spermatids from secondary spermatozoa is termed as spermatidogenesis. So spermatid, you are forming, so spermatids, genesis, you are forming spermatids. And so that's all. So spermatidogenesis is also different from spermatogenesis. It's also going to be different from spermiogenesis. I hope you are not confused. Right. So spermatids and stage 2, which is meiosis. So let's see what happens in the next stage. So next stage is spermiogenesis. Spermiogenesis. So now you are going to have a whole lot of metamorphic or transformation here. Remember we said that after the second stage, which is meiosis 2, you are forming spermatids. The spermatids, apart from the nature of the nucleus, everything is like the original cell. And so that they are all rounded, they all have central nucleus, they all have chromatin, they have the cytoplasm, everything. So it's at this stage, the spermiogenesis is at this stage where there's going to be a massive transformation from round cell to the elongated sperm cell that all of us know about. So stage 3 is a very complex area where there are also a lot of things that are going to happen. We're going to mention them. I hope that point is clear. In the stage 3, there's not going to be any further division. No, there's not going to be any. It's going to be we call it metamorphic change. Metamorphism. Metamorphic. Morphic is shape. Meta, multiple. So you're going to have multiple changes in the shape. All right. So that is what is going to happen in stage 3. So the spermiogenesis is going to be like, we also call it cytodifferentiation. So the cyto is cell different. The cell is going to differentiate. It's going to cause a lot of changes. All right. So let us now go to look at the transformational changes that will take place in stage 3. let's look at the transformational changes that take place in stage 3. So the stage 3 will begin at the end of stage 2, and stage 2 ends at second mitotic division. Remember, you have the first mitotic division, meiosis, second meiosis. Okay, now at the end of second meiosis, there's no going to be any further division. Then it's rather going to be realigning the cell, which is rounded, to become elongated. And this is the defining moment. We call it spermiogenesis. And we can say that because there's going to be a lot of different differentiation, this can describe the whole transformation as cytodifferentiation, cell differentiation, differences within the cell. So, and it's a very complex thing. Let's look at the complexity of the whole thing. But before then, the early spermatids, I'm sure that the early spermatids are the end product of the second meiosis, or the meiotic, not mitotic. The second meiotic change will give you the spermatids. All right. So they are haploid. Remember, they look very similar to cells in the earlier stage I've mentioned before. How similar are they? They are similar to the extent that their cells are rounded. They have spherical central nucleus containing diffuse and homogeneous chromatin. Now, who can tell me why the nucleus is still central, but and that is one of the, as we move along, we're going to look at what we call the chromatin integrity of sperms. How is it able to compact? How is it able to be condensed? How is it able to be repackaged? That is also a determining factor in fertility. And that's why semen analysis has no answer, because semen analysis don't look at the nucleus, what is within the nucleus, how the nucleus is, the content of the nucleus. Semen analysis doesn't do that. Semen analysis will only, if possible, look at the morphology of the, what do you call it, of the sperm, and look at the shape of the head and blah, blah, blah. That's all that semen analysis can do. Semen analysis don't have what it takes to look at the integrity of the chromatin. And the integrity of the chromatin is so critical in fertilization. And so you are saying here that this spermiogenesis is very key, because spermiogenesis is the stage where the homogeneous nucleus, okay, which is diffuse, I mean, it's like, will have to be repackaged, will have to become condensed. So if it's not able to be condensed very well, then it's going to affect fertility. All right. So these are some of the things, and like students of semenology, these are the things, so that you don't look at somebody can have semen analysis, everything is correct. And it's, oh, because your semen analysis is correct, I don't see why you shouldn't be able to father a child. But you know the integrity of the nuclear chromatin. You know it. You don't know it. So with your knowledge, you can still go ahead and look. In advanced places, you have what we call nuclear integrity tests. They're looking at how, and then this one will also give you an indication of whether spermiogenesis, that stage of spermiogenesis, whether something disrupted it. And then as you move along, you can look at what are some of the things that can also that can influence negatively spermiogenesis, not spermatogenesis, spermiogenesis, because this is the stage that's going to determine how compact the nucleus is going to be. I hope my point is very clear here. Very good. So during spermiogenesis phase, the haploid round immature sperm cell, which is the spermatous, undergo remarkable transformation. I've called this already, I've talked about this already, metamorphic changes to produce the mature elongated sperms. Now, let's move on and look at step by step spermiogenesis. So it means that even within spermiogenesis, there are phases, step by step stages within the spermiogenesis, not spermatogenesis. Spermatogenesis, you're talking about mitosis, you're talking about meiosis. Within meiosis, you have meiosis 1, meiosis 2, and then you are time to talk about spermiogenesis. All right. Within spermiogenesis, I'm saying there are also even stages there. We are looking. The first stage is that the nucleus polarizes to one side of the cell. Remember, we said that the spermatid, which is going to be used as the beginning product for spermiogenesis, because by the time you are ending the stage 2, which is the second meiosis stage, you have produced spermatids. You said that the spermatids are just like the original, listen, they are rounded, and the nucleus too is rounded. So with the spermiogenesis, this is where you are going to have what we call the cytodifferentiation. The cell will have to differentiate. The cell will have to go through a lot of transformational changes. And one of the first transformation changes is that the nucleus, which we know is at the center of the spermatid, will have to move to one side. So we have the nucleus will polarize to one side of the cell, and then the DNA becomes tightly packaged at the head. So the nucleus, remember we said that the nucleus is now homogeneous and then it's like loose. So the nucleus will have to be repackaged and then become tight. All right. And then they become very condensed. We call this the other, you can say chromatin condensation stage, or DNA condensation stage, or nuclear DNA condensation stage, whichever. So because it is the nucleus that contains the DNA, so you can say nuclear DNA condensation. And the nuclear DNA is also the chromatin. So you can also call it chromatin condensation, whichever way you want it. You need to understand some of this so that wherever you meet it, and whoever says something, you appreciate it. So if you say nuclear condensation, you are not wrong. If you say DNA condensation, you are not wrong. If you say nuclear DNA condensation, you are not wrong. Neither are you wrong if you say chromatin condensation. All right. And this is one of the early things that will have to happen in the spermiogenesis. The nucleus will have to move to one side, and then in movement, the nuclear material, which is the chromatin, which is the DNA, will have to now become tight and packaged to become compact. And like I'm saying that determines what we call the chromatin integrity. How tight is that? Good. So, and then we know that for normal cells, and like we said again and again, spermatids are just like normal cells, except that they are haploids, except that their DNA contains only one set of the double chromosomes, right? Apart from that, it's just an ordinary cell. And so cells have mitochondria, cells have centrioles. I'm sure you know all this is your basic anatomy. Centrioles and then Golgi bodies, all those things are within a cell. So then one of the centrioles, you can have multiple centrioles. One centrioles will elongate to become the tail of the sperm. So you see that the cell within the spermiogenesis is going to go through some complex transformation. The nucleus moving to one side, repackaging its content to become very condensed, and then the centrioles will now push I know centrioles are long things. All right, so the centrioles will push downwards and then become the they become the flagella. So this is also development of the flagellum. You know, the flagellum is also the tail. So you can call it development of the flagellum or development of the tail. And that is now developed through the centrioles. So this is also one of the organelles within the cell, which will move downwards to form the flagellum. There's also migration of the mitochondria. Remember, we said that for every cell, human cell, of course, or animal cell, there's mitochondria. So mitochondria will also now come. So now you have had the head, the nucleus. That will happen within the cell. Now let's see another major change that will happen. There, remember we said that for cells, for all human cells, you also have Golgi apparatus. You know this already. So the Golgi apparatus will also now move to surround the condensed nucleus. Remember now the nucleus have become condensed. So the Golgi apparatus will move in there to surround it to form something like a cap. And this cap which becomes the acrosome. I'm sure you know that for every sperm, there's a head, there's an acrosome. All right. So this is also how the acrosomes are formed. So the acrosomes are indeed formed from the Golgi apparatus of the animal cell, or for that matter, of the spermatids. Then another drastic change will also happen. So you see that the nucleus are moved, it has condensed. The Golgi apparatus has moved to cells are moved down to form the tail, and then in between you have gotten the what we call it, the mitochondria in there as the intermediates. So then what happens? Then there's going to be a major reduction in the size of the cell. There's going to be drastic reduction of the cytoplasm. Excess cytoplasm and organelles known as residual bodies are phagocytized by the surrounding Sertoli cells. This is what we call a maturation phase. So you see that this whole thing, it is only one cell, not the normal cell that you know, which has undergone some sort of differentiation or some transformations, if you like it. So now it is still a cell. Now the cytoplasm will have to be reduced. Okay, so everything which is now left, apart from the major things that you talked about, the head becoming the nucleus, the head acrosome, the centrals, and then mitochondria. All other things which are left are called residual bodies. No more important. So you know that these things are happening under the guidance of the Sertoli cells. Remember that the Sertoli cells that have the what do you call it? The androgen binding proteins. Remember, the Sertoli cells have the androgen binding protein. It is the androgen binding proteins that will also bind testosterone. It is the same Sertoli cells that also have the receptors for the follicle. All the course, yeah, they are being faggot or they are nursed by the Sertoli cells. So it means that all things is being done attached to the Sertoli cells. Because without Sertoli cells, the germ cells themselves don't have receptors for testosterone. They don't have receptors for follicle-stimulating hormones. The follicle-stimulating hormones and then the testosterone, they are all bound to the Sertoli cells. And these are the things that is stimulating the development, this kind of differentiation. So you see that the germ cells, up to this level, they are still attached to Sertoli cells. Now, so the Sertoli cells will not absorb the unwanted, which we call the residual bodies, which are left within the spermatids. I hope that you are getting the point. So the spermatids have taken a certain shape, but the excess cytoplasm will have to be taken off. All the other things which have not been used, which you call the residual bodies, will have to take it off. It is the Sertoli cells which will mop up all the unwanted things within the cytoplasm. And so once this is happening, it will reduce drastically the cell size of the sperm or the spermatid, if you like it. And so I'm sure you may have read that. What is the smallest size, the smallest cell in the body? The smallest cell in the human body is the sperm. So we have one cell which have now been gone through this transformation, is going to now also lose a huge of cytoplasm. That's going to be very, very small. So that explains why the sperm cell is the smallest cell in the human body. However, if you go to the female, the ovum, which is the female component, is the largest cell in the human body. So these things, you know them. I'm sure you know them already. So since you are the humans, the sperm cell is the smallest cell in the human body. And I'm sure up to the point you can understand why it is. So this is stage which is also very, very critical, the maturation phase, where the Sertoli cells mop up all the unwanted cytoplasm, the residual body, everything which cannot be used up or which is not necessary will be mopped up. Now, let's see what happens again. Lose genetic material. This is going to be condensed, repackaged to become so compact. At the end of it all, 96%, the what will become of it represent just about 4% of the original nucleus. So it will have lost 96%. So the entire nucleus will have been reduced to something insignificant, very something small. And then the entire cytoplasm will also have lost about 96%. So in totality, we are saying that the sperm cell, by the time it becomes mature, will have lost about 7% of the original cell. And to the mature elongated spermatozoa are formed. And where are they formed? They are now, you see, you said that within the tubules. And you can imagine the tubule. You have the base, which is made up of the germ cells. So as the division is going on, they are moving gradually into the lumen. And you know the lumen is the space that is within the tube. So for example, you have the germ cells at the base of the tube. You can have the spermatids somewhere in between the base and then the lumen. And by the time the the maturation is completed, they'll be almost in the lumen. but they will still be attached to the Sertoli cells. Remember, the Sertoli cells are huge cells, and they are guiding the process of the spermatogenesis. So what we are saying is that at the base, you have the germ cells or the spermatogonial stem cells. As they are developing to become mature, they are moving gradually, getting closer to the lumen. However, they are still attached to the Sertoli cells, right? So this is where the spermiogenesis will end, spermatogenesis. Now, so remember that spermiogenesis was the third stage. The first stage was the mitosis. Second stage was the meiosis 1, meiosis 2. Third stage is the spermiogenesis. And spermiogenesis also had a lot of stages, including the nuclear condensation, including the tail formation, including the mid-piece mitochondria, and all those things. And then lastly, including the maturation phase, where the Sertoli cells will also mop up or phagocytize all the unwanted elements within the cell, which we call the residual bodies, and including the cytoplasmic, including the cytoplasm. They'll mop everything up. But that doesn't end it. I'm saying that at this point, the spermatids, even though have become mature, they are still attached to the Sertoli cells. So what next? So the next step will be the spermiation. So the spermiation is the final stage of spermiogenesis. So we are saying that in the spermiogenesis, there's a whole lot of transformational changes that will convert the original round spermatids into elongated spermatids, if you want. Now, they are still attached to the Sertoli cells, and they must be released into the lumen. So the release of the spermatids into the lumen to make them free, now independent, is called spermiation. And that will have ended spermiogenesis. I hope the point is clear. So spermiogenesis is not the final stage of spermiogenesis. The spermiation is the final stage of spermiogenesis, not spermatogenesis. I hope the point is clear. If you have any problem, you can put it on the list. So spermiation, it is the process by which mature sperms are eventually released from the Sertoli cells into the lumen of the seminiferous tubule prior to their passage to the epididymis. It is a critical determinant of the number of sperm entering the sperm epididymis and thus the sperm content of the ejaculate. What this means is that, look, the spermiation is the point where it has to be released. What if the Sertoli cells decide that, okay, I've finished, I mean, this is now complete, everything is fine, but I'm not going to release it? What are you going to do? What it means is that the number of sperm that will be available in the epididymis is going to be low. Like, I have my nephew who is working an apprentice. He said that his master, even though they are supposed to spend about 3 years apprenticeship, some of them will be there for about 7 years. So yes, you are finished. If the master says he will release you, what are you going to do? So spermiation is the process. Spermiation is very, very critical to the extent that the sperm have the stages from germ cells up to the final stage of the spermiogenesis, and even to the maturation. Everything has been done. Now, the mother which is nursing it, the situation which is nursing it, says that I'm not going to release you. What are you going to do? So that you still will have been matured, but they have not released you. So it means that where you are supposed to have a certain number of sperm cells in the ejaculate, you don't have it. So spermiation is very, very, very critical. Very, very, very critical. It is the critical determinant of the number of sperms that will be available for ejaculation. I hope that point is very, very clear. So that makes the spermiation another critical phase of the spermiogenesis. Good. I hope you have understood. So this diagram explains the schematic representation of some of the things that we talked about. So with the spermatogenesis, we talk about mitosis. Now, so from the spermatogonium, which is a 2N, and for that matter, a diploid, after mitosis, will give you the primary spermatocytes. This is where you also have the fate decision phase. Fate decision phase, where with these two, one of them will have to be sacrificed to go into the process to become a sperm cell, and then the other side will have to go back to replenish the pool of the stem cells. So this is what, and then so the primary spermatocyte will now go to meiosis. So you have the meiosis is the process where the 2N, the diploid now becomes what? A haploid. So the spermatocytes will now give you, after first meiosis, will give you secondary spermatocytes. And then the secondary spermatocyte will divide again by meiosis. So you have meiosis 2. So at the end of the second stage, which the second meiotic chromatin and then in between you have the mitochondria in there, and then we said that then after, then you have the Sertoli cells to mop up the excess, what you call the residual bodies. Everything will not be used. We have to mop up. We have to be phagocytized by the Sertoli cells, and so it makes it very, very small. And now comes this. At this point, we say that the stem cells here are cell attached to Sertoli cells, and it will have to be released into the lumen. The lumen. How to release the lumen. Now, the release of the sperm from the Sertoli cells into the lumen is what we call the spermiation. And you're saying that that is a critical moment, because if you have gone through all this process, become mature, and then your master says, I'm not going to release you, at the end of the day, the number of sperms that you have to release becomes low. All right. And if you can take care, you can say that the person is azoospermic. If you do a test, the test will show that, oh, the testis is active, it is producing, but except that the cells, the sperms are not being made available. So it means that there is a spermiation failure. All right. So once you say this, it makes you very, very, scientific. Once you say that, now from the even do have situation where they could even do testicular biopsy. Now everything shows that the sperms are being produced. But if sperms are being produced, why is it that the sperms are not available? Meanwhile, that you've done some tests and you know that it's not obstruction. You know, there could also be obstruction. There's nothing like obstruction. Sperms are being produced, yet they are not being made available, they are not being obstructed. Then we talk about spermiation failure. Spermiation failure, we talk about a lot of things that can also cause spermiation failure. So once you know all these things, it makes you very knowledgeable. It makes you also, be able to contribute to discussions on some of these things in a more scientific manner. All right. So we move on now. The duration for the entire process of spermatogenesis in humans is about 10 to 4 days. Some will be more, some but the average is 74 days. It can be. That is why it is important to know this, because if, let's say, you are treating a patient who have had, let's say, problem with morphology of cells or whatever, and you are treating the patient, you don't expect the anomaly to be corrected within what do you call it, within, let's say, a month or two. Because 74 days, average 74 days is close to, is it 3 months? Or yes, it's more than 2 months, isn't it? It's close to 3 months. So it means that if there was a problem which was producing abnormal cells or abnormal sperms, and you have corrected it, it is the new cells which are going to be produced will take about 3 months for them to mature to now come out. So that's why it is important to have this knowledge. So it was, oh, I've started the treatment and you want the results within 1 month. How possible? It's not possible, because at the point that the correction was made, if there was an error, the correction was made, new cells are being produced. It takes about 74 hours. So sorry, 74 days, which is close to about 3 months, for those new cells to go through the spermatogenesis process. So before they come out. And so why are you expecting them within, let's say, 1 month or 2 months? So these are the things that as scientists you should know, so that you can better counsel your patients or can make better contribution when you're dealing with fertility among men. All right. Remember, it says spermatogenesis continues for almost the entire life of a man. That's why you can get a 90-year-old man still being able to father this thing. Except that, of course, the numbers will go down, because we said that these are stimulated by hormones. And we said that with age, hormone production, especially testosterone, will go down. Why? Because the lady cells will begin to dwindle. The number of lady cells will begin to dwindle. Remember, the lady cells are outside, they are interstitial. They are outside this. So they don't have much protection as you have for, let's say, the Sertoli cells. Okay. So they are prone to destruction. And so it means that as years go by, the number of lady cells will go down. And therefore, the amount of testosterone production will also go down. And therefore, once all these are going down, it means that the amount of sperms which will be produced, which is also influenced by a high concentration of testosterone, will also go down. But that doesn't mean that the man cannot father. All right, so you have to take note of those. All right. Now let us look at some few factors. You'll end very soon. Let us look at factors that can affect spermatogenesis. One of the factors is heat. Heat. Remember, we've said over and over again that spermatogenesis is temperature dependent. And that is why God, in his own wisdom, allowed the scrotum and, for that matter, testicle to be outside. So the body temperature is around 37. And we said that spermatogenesis or sperm production requires a lower temperature than the body temperature, which is about between 2 to 4%. Sorry, 2 to 4 degrees lower than the body temperature. So anything that will also try to increase the testicular temperature is like defying God's order, so to speak. So anything which will increase testicular temperature could cause a spermatogenic crisis or failure. So any heat, so anywhere there is a potential for increase, increase in scrotal temperature could be a problem. So an increase in scrotal temperature can have deleterious effects on the spermatogenesis and the stop sperm production. Now, we'll go there, but let me also ask, if you remember, he said that in the varicose cell, they have problem with uh, sperm numbers or sperm production because in the varicose cell, you have huge inflow of blood, the varicose veins, and therefore it makes the testicular temperature be as though it's like the body temperature, and that will have that kind of uh, effect on the sperm production. Remember, we talked about the reactive oxygen species. Do you remember that? And we said that with the heat, we have high. We will talk more about that, but because you've done that already, I wanted to know whether you can collect that the reactive oxygen species, once we have increased temperature, there's potential for a lot of increased reactive oxygen species. And wherever you have reactive oxygen species, they endanger sperm production, especially even if they are produced, they are going to endanger the nucleus. Reactive oxygen species will attack DNAs, and it's the DNAs that make up the chromatin, the nuclear chromatin. The damaging is due to the reactive oxygen species. I'll talk more on that, but I just wanted you to recap what we did earlier on the hydrology. Okay. So anything that will cause an increased heat of the testicles is a danger for spermatogenesis. Today, my network has not been charged about. Oh, stuck somewhere. Okay, sorry. There's somebody who said that. So I hope you follow it up to this point. Heat is number one master of somatogenic failure. Now, let's move on. On the heat, we're going to talk about occupational heat exposures. So we're going to look at some of the things. When they talk about occupational heat exposure, we're talking about by the work that we do, some of the works that can expose us to heat, and for that matter, potentially cause scrotal hyperthermia, and for that matter, increase scrotal temperature. Bakers, this one all of us know. Bakers, they are exposed to a lot of heat, and that heat can transcend the whole body, including the scrotum, and for that matter, testicles. Welders, men who wear tight underwear. I'm sure you know this one. We have some men who put on about four panties and then boxer shorts before they put on. I mean, they want to behave like women. Some women will want to make their buttocks look good, and so they can put on multiple underwears and then give themselves some good shape. We have some guys too who want to do the same. They want to also make sure they show that they also have some good hips or something, and so they can put on about 3 or 4 panties, and then before they put on boxer short and blah blah blah. Once you do that, you are, of course, heating up the scrotum and, for that matter, the testes. And any heat that affects the testes has the potential to cause spermatogenic failure. All right. So riding bicycle, of course, on bicycle, you sit on bicycle and then it's like your whole scrotum is right on the bicycle seat, and especially for long hours. You can, if you're a bicycle rider, consistently riding, you have risk of exposing your testicles to heat, and of course to problem with spermatogenesis. And this thing, I think almost all of us are victims. Sitting with a laptop computer on the laps. You know that you can try it if you put the laptop on the table for a long time and then you lift it up. You see that the table is very hot. I'm sure you may have tried it before. If you put your laptop on the table for a long time, just pick it up. Just put your hand where the laptop was. You feel the heat. So if you put your laptop on your laps, of course that's why it's called a laptop. It's supposed to be put on your laps. But if you put your laptop on your laps for a long time, the heat that will generate will be concentrated around the testes or the scrotum area. And of course, as we are all learning now, we know that it will impact on spermatogenesis. What about drivers? Very good. What about drivers? If you drive for a long distance, in fact, I'm sure those of us who have grown a little bit, in those days when drivers, those who let's say, drive long distance, let's say they drive from Kumasi to Temele or Accra to Temele, when they drive for before they reach Temele, the way, and and that's why in those days, long distance drivers they have children. The route that they fly, they have children all around. Wherever, when they go some distance, they will sleep. They'll spend the night there. And of course, they don't sleep alone. Then they'll have some babies there. And these days, because of money, somebody wants to travel from uh, Accra to Accra, Accra to Tamale, all alone within one day without even stopping over. When stopping over, perhaps some 10, 15 minutes somewhere. And so, what you are asking, whatever. And so they were spending a couple of days on the road, enjoying themselves, and then fathering children along the route. These days, not because of money, it's not like that. So long distance drivers also are exposed to risk of exposing themselves to heat. And I'm sure all of us know that if you sit on the driver's seat for a long time, you get up and you put your hand on the seat. You yourself will feel the heat. All that heat, uh, I mean, temperature, and that's potential infertility. I'm sure there are some chemicals. You know that high androgen concentrations are required in the testes for spermatogenesis to proceed. This one we know, basic. Certain chemicals interfere with androgen action. When we talk about androgen, I'm sure you know, we talk basically about the testosterone. Okay, so and you know that we need high concentrations of testosterone in the seminiferous tubules to be able to get spermatogenesis, and for that matter, sperm production to take place. Certain chemicals interfere with androgens. We call those things endocrine disrupting chemicals or endocrine disruptors or anti-androgens. These are words that can be used interchangeably. Endocrine, you talk not talking about general, the hormones. Okay. But so you are talking about hormone disruptors. But if you say androgen disruptors, then you're talking specifically about androgen and therefore testosterone. So, I mean, generally you can say endocrine this sentence is self-explanatory. That certain chemicals have the potential to disrupt the action of testosterone. And those ones are called anti-androgens or endocrine disruptors or endocrine disrupting chemicals. And once we expose ourselves to those chemicals, some of them could even be herbal medications. I'm not saying herbal medications are not good. There's some herbal medications are actually endocrine disruptors. They disrupt the function of the endocrines. And you know that sperm production is influenced or facilitated by what they call the hormones. And so if you have chemicals that is disrupting hormonal action, then what do you expect to do? Yes, they can also end up giving you problem. There are also certain endogenous factors. For example, if you are high fever is high fever. You know this already. And when it's a high fever consistently, potentially the testicular area could also be affected, and then you have a problem. But those ones, I'm sure that you know that as you move along, you realize that those factors, for as long as you're able to, they are only transient. If you get yourself away from those ones, the effect will not be permanent. Now, so and of course, certain medications may interfere with spermatogenesis. All right, we end soon. Environmental contaminants. Talking about chronic exposure, when we talk about chronic exposure, talking about long-term exposure to acrylamides, they can damage spermatogonia. Remember, spermatogonia, they are the stem cell, the germ cells. So if you are destroying your germ cells, then what are you doing? And spermatocytes. So remember, you're saying that when the spermatogonia divide, the first division, they give you the spermatocytes. And these spermatocytes are just like the spermatogonia because these spermatozoas they are also diploids, and that's where the fate decision comes in there, where one will go back to also augment the stem cells and one will go to. So if you are getting this bulk of cells, the spermatogonia and spermatocytes are destroyed, then what are you doing? You are the fundamentals of the sperm production is being destroyed. And of course, so long, and what are acrylamides? Acrylamides is a chemical that can form in some foods during high temperature cooking processes. So any food that has been exposed to high temperatures, including frying, roasting, and baking, you get some of the components of the food converting to acrylamide. And so acrylamide is not like a contaminant from outside per se, but it is a contaminant which is generated through excessive heating. So you can have even your bread, and then if you decide that, oh, me, I like roasted bread, and so you heat it and heat it, some of the components of the bread will tend to acrylamide. Now, acrylamides, once they get into the body, have a tendency to also damage the spermatogonia. And so these are the things. So I'm not saying that you cannot eat fried rice. Me, I like fried rice, or roasted meat or whatever, but it should not be. You are talking about chronic for a long term, especially every day you are using every day, every time. Then you are increasing your acrylamide load that will have the potential of damaging your stem cells, your spermatogonia, and for that matter, potentially reducing your, uh, your sperm production. We'll finish soon here. All right, it's past 8. So I think we can continue from we can continue. So let us end at the acrylamide side and continue from tomorrow. Thank you, thank you, thank you. Any question, please? And I hope you have enjoyed the discussion. So you, even as you come to Semenology, it's not just about semen analysis. It's about a lot of things that you have to know before the semen analysis. All right. Thank you. See you tomorrow. Good night.